there's a huge problem with overdiagnosis of mental illness in our society. And again, I wasn't a person who like wanted to seek out like a diagnosis because I wanted whatever prescription pill I could get, you know what I mean? But I was a problem. Like I was a problem in other people's lives, not just my own. So like my parents were like, go. But I did, after I saw my doctor, she's just my primary doctor. She happens to be Catholic, and she offered to counsel me and to be like my monitor, basically. And after I moved on from that, I was, what was I, like 17 or 18 at this point. And I was like, hey, Mom and Dad, I actually want to start like real therapy, like with a therapist. And so my mom reached out to different people. Sorry, I just hit the microphone. Reached out to different people in the homeschool group, and got recommended a Catholic doctor, a Catholic therapist, and I started seeing her, and it did nothing for me. I would go and I would bring her like a problem that I was dealing with, and she would say, "How does that make you feel?" And I'd be like, I just told you exactly how that made me feel. And if I have to say that again, I'm going to scream. Like, I never got anything out of her other than, okay. I think you're feeling this. How does that make you feel? Like, I know what I'm feeling. I'm telling you what I'm feeling. I want you to tell me how to get over it. Yeah. Not like, I understand. I'm so self-aware at this point. I know exactly what's going on. I just need you to give me advice as a doctor on how to like get over the hump. You know what I mean? And so, yeah, there's a lot. I mean, and this was a Catholic therapist. And I thought like, okay, perfect. Like someone who shares the beliefs that I'm trying to like replenish in my life. And, you know, I'm on a good track, and I just need someone educated to tell me, you know, someone educated on mental health to tell me what to do when I'm feeling certain ways, or like, you know, how to deal with certain situations. And I got nothing. And I was like, after I think probably 4 or 5 months of seeing her, I just told my parents, I'm done with therapy. Like, you know what? I'm okay now. Like, I have tried so hard. I'm actually fine. Yeah. And I don't care.
So
like,
she worked.
I guess it worked because I got so sick of talking about my problems. I was like, I'm done. Yeah. I just don't want to do it anymore.
I think a lot of people go to those type of therapists because they get reassured.
Yeah.
Because they want to have a problem.
Right. And for some people, reassurance works. And for some people, that kind of like, let me help your thought process along works. But that's not what I needed. That's not what I was coming to her with. And that's not the angle I was at. Like, you know, we were just completely on different levels, and it did not work.
Yeah, and it's something that I was talking as a paramedic is like you have to treat the patient, not the monitor. Yeah. So that you're coming with like depression symptoms. Yeah. It's not boom, 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 boom.
It's not a textbook.
No, yeah, and it doesn't work like that. Mm-hmm. You have to acknowledge everything going on, but you also have to provide solutions, or not even a solution, at least a kind of pathway. Like, try this. Here's this prayer. Here's like the root of this, and here's another saint who went through something similar to you. Yeah, and that's what we need. And it's really hard for people.
There's a podcast where they discuss stuff like this.
Yeah, you're right here, just like you and me. Check it out.
I didn't know about that.
Yeah, and it go like, so people who might not have faith, we speak in a little broader terms. It's when you don't have something to anchor yourself in, right? Whether it's faith, some kind of religion, whatever it is. You kind of just float around, you're lost, and then you are your own God. Yeah, your feelings and everything that's your idol. That is your God. Right. That's everything. And if you just keep feeding that, you're gonna be empty, and you're just gonna keep going farther and farther and farther. You can start with just depression, and then it can form into something, to a bad habit with it, like anorexia, bulimia, whatever it may be, and it just continues to go farther and further and further. And then also, if you're not getting recognition, or people are just kind of like, all right, that they're depressed. Yeah. Then you go do something different. Mm-hmm. Then you go change how you look. You change your name, something crazy. And people will probably understand what I'm alluding to. Mm-hmm. And then it just keeps going and going and going. I think I did that really well, I think.
Yeah, that was really good. That was really good.
But it just keeps going. And it's sad because it's truly, you aren't able to actually heal. Yeah. You're just continuing to dig deeper into your scar, and you love it. And that's all you know. You have nothing else to go back to. Right. And that's scary. It's sad.
And I think that also leads to people think Catholics are absolutely insane. Yeah. Like, when you're not a Catholic and you're an outsider looking in and you're hearing all these opinions, especially if you're like left-winged, it sounds utterly insane. But to us, it's like, of course it's this way. Like, of course it's this way, which is why, like, I appreciate so much that I can empathize with other people's opinions, and it just makes it so much easier to relate to everyone. And I feel like I don't have to agree with people to be their friends. And I don't need them to think that I agree with them to be their friend either.